Let's stand for the invocation with Chaplain John Gerhardt.
Thank you, Dr. Malone. Let us pray. Dear God, we are grateful for the refreshing change of the seasons. With our transition to cooler weather, we find ourselves thankful for this invigorating change. But we are also mindful that not all change is welcome. Within the walls of our hospital today are many people who are experiencing an unwelcome change for the worse. New ailments are being discovered, diseases are debilitating, and lives are being threatened. And you have called upon us to make a difference. Grant us grace as we strive to bring change for the better. Help us to treat our patients wisely, with skill and compassion. Bless our efforts to bring healing and preserve life when it is possible, and help us to extend heartfelt mercy and support when it is not. Heal our patients, comfort their families, strengthen our staff, and grant wisdom to this, our hospital board. These things together we pray. Amen.
Let's do the Pledge of Allegiance together.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I call the Sarasota County Public Hospital Board meeting for October 20th to order. Let me provide this information. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. I ask for approvals of the orders of the day. We have a motion and a second. All those in favor, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you very much. And now approval of the minutes of the meeting of September 15th, 2014, and the tax, millage, and budget hearings of September 4th and September 15th. We have a motion and a second. All those in favor, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you very much. And now, we have the STAR Oncology Rehabilitation and Survivorship Program with Dr. Simon. And are you going to introduce her, Dr. Von Molnar? Thank you.
Thank you, Madam Chair. This month, it is my pleasure to introduce our physician speaker, Dr. Amesha Simon. After attending medical school in her home country of Hungary, Amesha completed her internship and residency in physical medicine and rehabilitation in 2005 at the University of Kentucky. She has been in private practice with Florida Rehabilitation Associates since 2006 and has served as the medical director of the spinal cord injury program at Health South Rehabilitation Hospital from 2008 to 2012, where she has presented multiple times on rehabilitation after stroke, spinal cord injury, and multiple sclerosis. Please give a warm welcome to Dr. Simon as she presents an update on the STAR Oncology Rehabilitation and Survivorship Program.
Thank you. And most of us personally or in family have been touched by cancer. I know myself, I have been, so this is a very dear topic to myself, having lost my dad 10 years ago. And as the treatment of cancer improves through medical advances, the survivors the number of survivors increased from 3 million in 1971 to about 13.7 million cancer survivors today. That brings up a very important topic about the challenges the cancer survivors face throughout their lifetime from their disease and also from the treatments. Because side effects from the very effective treatments can last for months and years after the treatment is finished, and follow-up care is required for the patients and for their families. And it is best approached in a multidisciplinary care. So we would like to basically improve outcomes with clinical education, patient satisfaction, functions, and outcomes through the START program. And basically, it is a multidisciplinary rehabilitation program for cancer survivors, and improves patient care and increases referrals. The key component is a comprehensive survivorship, multidisciplinary cancer rehabilitation care to improve the patient's ability to function and improve their quality of life. To help with their pain, their neuropathy, fatigue, weakness, nutrition, neck and shoulder problems, balance, walking, the gait problems, memory, concentration issues, swallowing, swelling, lymphedema wraps, and further treatments, and anxiety and depression. So we look at the survivorship through rehabilitation, again, with the multidisciplinary approach in a comprehensive manner through physical therapy, occupational therapists, a lot of psychology help, speech language therapists, the ambulatory care centers, with the nutrition as well as wellness coaching and mind and body classes, yoga, tai chi, qigong, and oncologist certified massage with the lymphedema help, which is very badly needed patients. It's through an outpatient therapy program with a rehabilitation prescription, basically, and telephone number for it. So that would be it. If you have any questions.
Thank you so much. Are there any questions from the board? We appreciate it. Thank you
Thank
for
you.
coming. And now we have an Excel winner this month, Katina Wilcox, an oncology care navigator at the Cancer Care Services.
Come on down. Put it right here, right where you are. So, Katina Wilcox is our Excel recipient for the month of October 2014. Katina is currently the Oncology Care Navigator in Cancer Care Services, has been an employee of SMH since June of 2001. Oh, look, Yolanda wants to take a picture. You're welcome. Katina serves as the, oh, I already read that, sorry. I'm going to make some comments from what your peers have said about you. Are you nervous? A little bit? They're all nice things. We scrub them. No, we didn't have to do that at all. Katina is exceptional and great to work with. I watch in awe as she provides outstanding care to our day treatment patients, many with very complicated situations. Katina brings humanness to everything she does. She is insightful, balanced, and team-oriented, which allows her to accomplish a lot of individuality while supporting the good of the whole. She regularly interfaces with staff of all disciplines, as well as the oncologist, and is highly respected by everyone for her outstanding clinical and administrative skills. I've watched Katina grow professionally into a role of what a nurse advocacy looks like. Katina is one of the most professional and positive nurses in all the organization. She is articulate, caring, and kind in her relationships. And above all else, she is genuine, and the patients know that. Her laugh is infectious, and more than one patient and family member has remarked about how she made them feel like someone was in their corner. Katina plays an invaluable role within cancer care services. She dedicates countless hours willingly to ensure SMH is represented within our community, our outreach events, and health fairs. Every day, she exceeds in her role in oncology services. She works tirelessly to help those less fortunate in our community with the care and medications they need. She's simply an amazing asset to both SMH and the community. Congratulations, and thank you for all you do.
Katina, that's a great story, and you have a beautiful plaque that I'll read into the record. Okay, Katina is an employee, part of a recognition program of Sarasota Memorial Healthcare System. The hospital board and administrative staff of Sarasota Memorial Healthcare System are grateful to all employees who constantly enhance the quality of a patient's stay by making an extra effort in their daily activities. The Excel program is designed to recognize employees who've distinguished themselves by superior performance and attention to others. Individuals recognized are models of excellence who strengthen the quality of a patient's care and the image of Sarasota Memorial Healthcare System in the community. The hospital board and administrative staff are pleased to present to you, Katina, with the Excel Award of October 2014 in recognition of your demonstrated courteous and caring attitude and contributions toward excellence at Sarasota Memorial Healthcare System. Signed by David Veranda, Chief Executive Officer, and Marguerite Malone, Chairman of the Board. Congratulations.
Thank you. Again, I would just like to say thank you, and I'm truly honored to be recognized for the work that I love to do. I'd like to thank my coworkers and my director as well. Thank you, and thank you for having this program.
Thank you. And we move on now to the report of the medical staff. Dr. Von Waldner, Chief of Staff.
Thank you again, Madam Chair. I have one action item for the board, and that is the approval of the protocols for TPN. This protocol has been approved by Credentials Committee and the Medical Executive Committee, which recommends your approval.
I move approval of the protocols for TPN as recommended by the Medical Executive Committee.
We have a motion and a second. Any discussion or questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you very much.
And that concludes my report.
And let us take this opportunity, Dr. Von Waldner, to thank you officially and in public for your wonderful work this year as Chief of Staff. This is your last official meeting as Chief of Staff, but as past Chief of Staff, we're going to see you all of next year. And Dr. Fioric is in the audience, who will become the new Chief of Staff at our next meeting. But we really appreciate everything you've done. Thank you so much.
Thank you very much. I leave you in very able hands.
And now we move on to the auxiliary report. And we have a new auxiliary president. It's Dottie Ziegler.
Thank you, Madam Chair. The auxiliary would first like to thank you and the Sarasota Healthcare System and the board for the lovely annual volunteer luncheon that we enjoyed on October 8th. Mary Malali was very instrumental in taking care of all the meals and who got what kind of entrees and the lovely flowers on the table. She did all of that, and we want to give her credit for that job. All the volunteers who were able to attend had a very enjoyable time, and we thank all of you who were able to attend with us for coming and enjoying the day. The new auxiliary board was installed at the luncheon and includes myself, Dottie Ziegler, President. First Vice President is Ed Miller. Second Vice President is Rose Panich, continuing from last year. Our new treasurer for this year is Dan Trigg. Recording secretary is Carolyn Dammers, and she remains on the board. And corresponding secretary is Mary Malali, and she remains. I look forward to working with this board in the coming year. We have many opportunities to support the operations of Sarasota healthcare system. Currently, we are present in not only the main hospital, but also the Northport Emergency Department, IFAM as greeters, transporters, and also we've expanded into the cardiopulmonary rehab there. The Breast Health Center has a wonderful, talented group of breast cancer survivors who work with our patients and staff there. I look forward to sharing with you more of our initiatives, including the successful pilot that we've just completed at the Cape Surgery, to segue into a volunteer presence there. This concludes my report.
Thank you very much and welcome.
Thank you.
And now for the Sarasota Memorial Healthcare Foundation, Ms. Alex Quarles, President.
Thank you very much, and Dottie, thank you for a wonderful lunch. I enjoyed being there and watching you being inducted, and to the auxiliary who do so much for this community, and we'd certainly like to be closer partners with you and help us any way we can. Very, very brief report. Key to the Cure was a resounding success. Thank you, Alex Miller, one of our co-chairs was there. I think we had close to, 1,700 people? She's Alex, I'm Alex squared. Anyway, do you want to add anything about the event? Oh, dear. Okay, then. It was terrific. David, thank you for being there. Dr. Malone, thank you, all the trustees that were able to be there. We really had a spectacular event. And 2 days later, we were introduced, Dr. Malone and I were introduced to the head of all of Saks Fifth Avenue, a beautiful young British woman who rolls up in a Rolls Royce to great applause. And it was quite a treat to be there and to see such enthusiasm with everybody that was there. And I want to thank my team and all the volunteers, the hospital volunteers, who helped us with that, because that's not an easy task to manage 1,700 people. It's a lot of cats to herd. But it was terrific. And our goal was to reach $1 million after 9 years of being involved with them. We feel that after the 4 days of shopping afterwards and what Saks is, and from what we were told, or what I had been told later, was that this was the best Saks event of the entire country. So that says a lot for Sarasota Memorial and Sarasota the community in general. So that's really wonderful. We believe that we've reached that $1 million, which of course goes to cancer services here at the hospital. A couple of upcoming things that are going on underway now. Our Professional Advisors Network is coming up on the 28th. Those are our individuals who are trust officers, CPAs, looking for continuing legal education units. Subject matter is going to be regarding elder law and the abuse of elder law, particularly in the state of Florida. We've actually had to deal with that as a foundation, unfortunately, with some of our donors who've had some difficult times. But more importantly, we have Maria DiCarlo, who is going to be talking about the new rehab center as a second component to this particular event. If you'd like to come, please let us know. It's going to be quite interesting conversation. The next activity we have, of course, we're in the middle of the audit, and I'm sure you all are as well, is our Corinthian Society event, which, if you'll mark your calendars, is December 11th at the Bird Key Yacht Club, and that's when we recognize and welcome our newest Corinthian Society members, and recognize all of our doctors of philanthropy that are new also from the past fiscal year, not the current one. And in addition to that, the gala is fast and furiously underway. We have our committee in place. The date for that is January 24th at the Ritz-Carlton. Look forward to seeing all of you there. And I just want to quickly announce that on November 10th, the board will be invited to a special recognition for the new Brian Johnson Music Therapy Center that will take place. And the facility's coming along nicely, and we expect that to be quite a media event. So we'll keep you posted as the time gets closer to that, what we're going to be doing. And finally, I want to recognize some new staff members. One in particular is Nikki Taylor. If she'd stand up and say hello. Nikki Taylor is our new Director of Marketing for the Healthcare Foundation. I think you've already met Tula Kane, who's Director of Major Gifts in the past, and we have a new person that's sitting at the front desk. Her name is Misty Bear. We swiped both of them from FSU. Bruce is barely talking to me these days, but that's okay. We got the better of the deal. But we're working jointly on some project with FSU, so that will be something that will come along very nicely, so we welcome you there. And I promoted Jackie Keller, who was our development assistant, to prospect research. So you'll be seeing us do an awful lot of background work and information on individuals so that when we talk to them about how they can help us and help you, we'll have much more information. Unless you have any questions, that concludes my report. Thank you.
Well, thank you, and all of us on the board want to thank you for your leadership for the Key to the Cure and all the work the foundation does, and we're very proud that our Alex was part of that leadership team, and it really was a wonderful event, so thank you and your board and all the volunteers very much. Thanks. So our secretary's report, Mr. Tom Towler.
Thank you, Madam Chair. I have the November board meeting schedule. On November 6th, which is a Thursday, we have 8 o'clock board breakfast, 9 o'clock the Quality Committee meets, 10 o'clock Finance Committee meets, 11 o'clock the Governance Committee meets, and 12 noon the Investment Committee meets. On Tuesday, the 18th of November, the board meets again, 10 o'clock, with a meeting with Representative Stube. At 11 o'clock, review of finances. At 11:30, peer review. And at 1 o'clock, the public board meeting. That's my report, Madam Chair.
Thank you very much. We'll move on to the treasurer's report. Mr. Dick Donegan.
Okay, I move the approval of the bad debts and charity care for the month of ended September 30th, 2014, in the amount of $11,126,000.
Second.
We have a motion and a second. All those in favor, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you very much. And that's the end of your report, Mr. Donegan? Yes, it is. Thank you very much. So we'll move on to the first operations report. Mr. Bill Wojin, Chief Financial Officer.
Good afternoon, Madam Chair. I have the financial highlights for September 2014. With September being the last month of our fiscal year, we don't have the financial statistics for expenses and income because we keep the books open longer for the audit, preparation for the audit. But I do have the hospital paid hours per adjusted admission. For the month of September, 137. For the fiscal year to date, it was 130, just slightly higher than fiscal year 13, which was 127. The hospital outpatient registrations for September year to date, for the full fiscal year, 395,599 compared to a budget of 413,427. Registrations in the Emergency Care Center for the fiscal year, 108,462 compared to a budget of 100,439. For the hospital's average daily occupancy for fiscal 14, 399 compared to a budget of 375. Our admissions totaled 27,454 for the fiscal year, and that compared favorably to the budget of 25,192. Our average length of stay was 4.7 days, which was the same as the prior year. The hospital's surgery cases totaled 19,313 for the fiscal year, compared to a budget of 19,734. Births, there were 3,097 in fiscal 14, compared to a budget of 2,830. And our case mix index for all patients was 1.68 for the fiscal year, and for Medicare patients, 1.85. Madam Chair, that concludes my report unless there's any questions.
Thank you very much. And next, Ms. Jan Mock, Chief Nursing Officer.
Good afternoon, and I'm going to spend my report on a topic that's very near and dear to on the minds of Sarasota Memorial Healthcare System workers, our community, our nation, and obviously the world. I think we've all heard throughout the last month or so a lot of discussion, a lot of concerns about Ebola, and I want to share with you the efforts that we have done at Sarasota Memorial Healthcare System to be prepared. We have two primary goals. One is to keep our employees at Sarasota Memorial Healthcare System and volunteers and physicians safe. And the other is to screen and provide coordinated quality care to any patient who might enter our doors at any location with the possibility of having Ebola. I want to take this opportunity publicly to thank the steering group, a member of about 20 people from our organization with all different levels of expertise, who put together the plan that we have now, which we call our interim guidance for Ebola. And the reason we call it interim is because I think, as you've seen through the news and the events that have led up to where we are today, it's changing hourly, daily, weekly, and monthly. So this steering group is very focused on having the most up-to-date information to handle all of the events and to keep it ongoing as it evolves. So I want to thank them. We addressed 5 main areas when we looked at our interim guidance for Ebola virus. The first one addresses patient flow. And as I mentioned earlier, it has to do about screening. And as you know, in our healthcare system, we have many areas where a patient might come in contact with the health system, whether it's in the outpatient side, a physician's office, or urgent care, or a diagnostic area such as radiology. And also the main campus, where we do have patients come in for procedures and different things. So the screening in all those areas are very, very important. And basically, just simply, the screening addresses where they've traveled, and I'm sure now the guidelines as of today will include Dallas and any of the areas, so that'll be ongoing. And also the signs and symptoms they have that are very specific. So these are the questions that are asked. Then we developed an internal alert for our health system where they call a certain number, and a team of about 20 members called the E-team, similar to what we've established for our stroke patients and our DASH patients with an MI would come into our facility. So we're very prepared. We have all the people on board that can implement this process. Then we established where the patient would go. And obviously the key thing here is you don't want to expose any of the healthcare workers that aren't necessary any more than possible. So we have a very streamlined pattern of where the patient would go and how they would get there, and this E-team would be making all those decisions based on the conditions at hand as they present. The next key area of focus is on, we call it PPE, it's personal protective equipment, and the equipment we need to protect our staff and to care for the patient. And this is, as you can see in the news, this is one of the most concerns of our healthcare system employees. We developed 2 tiers. One is for those who have prolonged exposure, such as your nurses, and those with short exposure, such as your physicians, lab personnel, respiratory, those kinds of areas that would have short exposure. We have all the supplies on board here in the facility, located in the emergency room in the ICU, and ready to be deployed to any area where a patient might present themselves. And I want to thank the supply chain staff for their help in securing this. We also addressed in our guideline how to dispose of any waste. That's a big topic, and a key thing in any room that we put this patient is to make sure that we want to go the highest level of protection, and that is negative pressure, and that there's an ante-room so that people can put on and take off their equipment, which is, taking off is the riskiest area for contamination. The next thing is education, house-wide education, which has already gone out to all of our members of Sarasota Memorial Healthcare System, and the board got that information also, as well as more of an in-depth education for our core staff. We feel it's very important to have a core staff who would be responsible and trained to care for these patients. So that is taking place as we meet now, where we'll be identifying that core staff, and education will be taking place in the next week. We have 15 nurses who've had extensive training in hazmat kind of protection. And so those nurses will be doing the training and will also fill in if we have a lack of staff that are properly trained. So we feel we have a good plan. Also, we have security and environmental services that have been to this extensive training, and we feel very fortunate that we have that on board and have had for about 4 years. The next aspect is communication, and we've developed a phone line for all of our physicians, volunteers, and staff to call in, this is internal, with any questions, concerns, and we will have the infection control department field those questions and answer them and have them on our Pulse site. We've developed an Ebola icon where easily can be accessed any information that you would want about guidelines, up-to-date guidelines. If we had a patient, we would develop daily communication similar to our command center in the midst of a emergency. And then also we will be communicating regularly with our health department, the state health department, and the CDC. The next area that we addressed is the care of the patient as well as the staffing. We know we have to have, as I mentioned earlier, core staff. We have to have a buddy system that helps with that protective equipment, as well as oversees the monitoring of people going in and out of the room and making sure that there are no breaches in the contact PPE. And also, we've identified with our physicians the physician roles. This week, we have another steering group. We will also be meeting with the community hospitals in this area to discuss together how we might help and support each other and learn from each other. And I want to take this opportunity to thank Steve Taylor, who's co-leading this effort with me, Ruben Holland and Joel Gerber from the emergency room, and particularly Manny Gordillo, our infection control expert, who's put tireless hours and very much engaged in helping us achieve these guidelines. And thanking the steering committee for their efforts. And I do feel we are very well prepared. No one knows what might happen, but I also think that we will have state and federal support in helping us as we move along this path. So I want you as a board and a community to know we feel, as of today, with the current guidelines, we are very prepared to handle this situation in our community and in our healthcare system. Does anybody have any questions? Okay, thank you.
Thank you very much, Jan. And David, thanks for your leadership on all this. We really are out in front, and the board's very proud of that. We have no board reports. We'll move to committee reports. Audit Committee, Mr. Darrell Henry, Chairman of the Audit Committee.
Thank you, Madam Chairman. The Audit Committee met on October 7th at 11:30 in the Harrison Room. Mark Thornton, Audit Services Director, reported on the completed audit projects for the fourth quarter. Much to my pride of what the things Mark has done, they include drug diversion program monitoring, after-hours perimeter security, meaningful use risk analysis and gap assessment, and also safeguarding of radiological materials. Your audits in process or planned for the first quarter include continuation of the drug diversion program, hurricane preparedness, bad debt for non-emergent emissions, medication barcode scanning project, plus some additional topics. Mr. Thornton walked the committee through the annual audit plan for 2014 to 2015. He reviewed the background on global and national information items and trends throughout the United States. He discussed preparation for the annual plan, critical and strategic issues. He reiterated the goals of improving safety, quality of operation, financial, and IT controls. Mark Thornton asked for approval of the 2014-2015 annual audit plan. The audit committee voted unanimously to recommend full approval of the 2014-2015 annual audit plan at this board meeting. Therefore, I move approval of the annual audit plan as recommended by the audit committee.
Second.
We have a motion and a second. All those in favor, is there any discussion? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
There being no further business brought before the committee, the meeting was adjourned. That concludes my report, Madam Chairman.
Thank you very much. We'll move on to the Mission and Planning Committee. Mr. Greg Carter, Chairman of the committee.
Thank you, Madam Chair. The Mission and Planning Committee met on Tuesday, October 7th, and we started with a trauma center update from Jean Lucas, nurse executive, and she led the presentation, provided her background in emergency nursing and trauma at Johns Hopkins before coming here. Jean provided the highlights of our ongoing assessment, and she reviewed the agenda, which included definition of trauma, why the designation is given, the trauma service area map, population projections, and what we have learned and read, and the next steps coming up. SMH is considering a trauma center because there's an open slot for this region for a second trauma center. Venice and Manatee Memorial have filed along with SMH, and the trauma aligns with our mission and vision for our community. Jean discussed the various hospitals and trauma centers in the region and reviewed the trauma service population projections over the next 10 to 15 years for the three counties, Sarasota, Manatee, and DeSoto. Coverage requirements were discussed and specialties required were provided, and they include trauma surgeons, general surgery, and operating rooms, anesthesia, neurosurgery, as well as radiology, ECC, trauma resuscitation, ICU, and various surgical specialties. Our next steps include gathering information and completing the assessment to conclude if this is doable for SMH, exploring potential relationships with key partners. And this will culminate in the April 1st, 2015 application deadline. And next, Dr. Von Wallner discussed the concerns of the medical staff, and there was a general discussion regarding trauma and the process. Our next item was TAVR update, and David Patterson and Jennifer Sullivan provided an update on the TAVR program. We are exceeding the national standards for TAVR right now, and this program started in September of 2012. Jennifer has done an excellent job in managing the service, which is not inexpensive, and it is losing money. That stated, it is what our community needs, and we are providing the service to the community. Jennifer discussed the program overview, patient volumes, financials, changes in reimbursement, patient outcomes, and measures of improvement. Putting this service into perspective, patients having severe inoperable aortic stenosis have a low survival rate, and this program is patient-focused with a multidisciplinary heart team approach. She showed pictures of the valve that is used and the use of a balloon to install this. TAVR outcomes were discussed, and patient assessment of improvement, and a patient testimony video was shown. The next item was the Courtyard Tower final audit from Tom Perigo, and he reported that the project successes and provided a project update. $5.4 million from the contingency budget is what came back to the hospital. Tom reviewed the numbers leading up to this $5.4 million, and this is quite a success story. And the last item was before we adjourned, Dr. Malone and myself read and presented plaques for James Toll and Robert Palomeni for their service as community members to the Mission and Planning Committee over the past 15 years. And that concludes my report, Madam Chair.
Thank you very much. We'll move on to the Quality Committee. Mr. Bob Strasser, Chairman.
Thank you very much, Madam Chair. Since the Quality Committee meeting is held in closed session, go ahead this time.
Thank you. So we'll move on to the President's report. Mr. David Verinder, President and CEO.
Thank you, Madam Chair. I'm going to start today, as we always do, with our report card, our leader report card. This is our 2014, and it is for the completion of the year, as September 30th is our year end. We start under the service pillar, and we look at our HCAP scores. We had a goal of hitting 9 out of 10 for at the 50th percentile. We came in a little short from that for the year and came in at 7 out of the 10 at the 50th percentile. Under outpatient, we had a goal of 83rd percentile, and we came in just a little bit above that at 84th percentile. Under the people pillar, we had a Gallup employee survey grand mean score goal of 4.26. I'm happy to report that for the year we came in above that at 4.29. We had merits on time, a goal of being 95% of the time, and I'm happy to report we exceeded that and hit 98% of the time. Under the quality pillar, we had our value-based purchasing, 100% or greater of CMS reimbursement, and I will report that we were just a tad bit under that for the year at 99.8%, so close but a little bit off our mark. Organizational percent of patient safety readiness, we had a goal of 95%, and we exceeded that and came in at 99%. Infection prevention, combined overall standardized infection rate, we had a goal of being under 1.0. We did miss that mark. We came in a little bit higher at 1.09, but I am happy to report that that continues to come down month after month. As the prior month, we were at 1.12. So we continue to make great strides with that. Into the financial pillar, our organizational finance goal was 4.2%, and I'm happy to report that we do have a preliminary number of 10.9% operating margin. That is a preliminary number, and we now are in our audit process with KPMG, and we'll release that final number when it comes out. But we feel pretty comfortable that will end up being that number higher. In the growth pillar, we had our strategic growth org goals being the first one being inpatient admissions. We had a goal of 25,192. And I'm happy to report we exceeded that quite a bit, about 27,454. And on the outpatient registrations, we had a goal of 812,000, came in a little bit short of that at 810,000. Moving on to service, this is our September 2014 HCAP scores, and I'm thrilled to report that in September 14 we hit 10 out of 10. So it's the first time this organization's ever done that. And so can't thank our leadership between Jan and Steve and the rest of our nursing directors and clinical directors for their assistance there.
That's outstanding.
When we look at our HCAP scores for July to September, we look at our fiscal year, as I reported a minute ago, being 7 out of 10. But our fourth quarter being July through September being 9 out of 10. So once again, very close to the mark. In the outpatient likelihood of recommending our outpatient service, as I reported, we had an actual of 84th percentile, and the goal was the 83rd percentile. And you see here the departments that are below the 50th percentile, the above the 50th, and then above the 83rd. And what you do see is you continue to see more and more departments moving to the middle or moving to the far right, and it's a very positive trend. Moving into the people category, the week of September 15th was the Environmental Services Week, so SMH got a chance to celebrate our team. As you can tell, they had a good time through some of the pictures here. The engaged group is dedicated to keeping our environment of care in top condition, easy to recognize in their signature blue polo shirts. This department is also one of the largest in the hospital. Staying in the people category, we're very proud of our team that participated in the 2014 American Heart Association Heart Walk on September 20th in Payne Park. As the top fundraising company, we also captured the fittest physician, nurse, and staff. Thank you to all of our staff, physicians, and volunteers who braved the soggy weather and wind. It says in pups there because we have a number of people bring their dogs with them to help them walk around, which is actually very enjoyable. Continuing in the people category, we had our integrated case management week was celebrated last week. This is the team that coordinates a full spectrum of care for all of our patients, ensuring that each plan fits each patient. Thank you for your dedication and service to all of our patients and families. It's a nice picture of the team. And just so we could embarrass Alex a little bit, Sarasota Memorial Healthcare Foundation President and CEO Alex Quarles just celebrated her 20th anniversary at the foundation. So congratulations, Alex, and thank you for all you've done for the hospital and community. I missed one. We had our staying in quality and safety. We had our Sarasota Memorial physicians recently achieved a heartfelt milestone. We're performing our 100th transcatheter aortic valve replacement, or TAVR. This minimally invasive catheter-based procedure technology is giving people deemed inoperable and have high risk of dying from severe aortic stenosis a second chance to live. And Mr. Carter gave a description of that in his Mission and Planning Committee, and I think the team did a great job in there showing how the valve worked and what we do. Staying in quality and safety, September 27th was our Men's Health Forum at the Robert L. Taylor Community Center. Mayor Willie Charles Shaw offered and welcomed and presented a proclamation from the city of Sarasota for Prostate Cancer Awareness Month. Physician speakers included Dwight Fitch, MD of 21st Century Oncology, Daniel Kaplan, MD of Urology Treatment Center, and Lisa Merritt, MD of Multicultural Health Initiative, spoke to over 50 members of the community about men's health awareness, and Tracy Gappin, MD of Florida Urology Specialist, provided complimentary screenings. Thank you all who helped make this a fantastic event. And we also had one of our own plastic surgeons, Dr. James Schmidt of Sarasota Plastic Surgery Center, who joined a mission to Honduras to help repair children's cleft lips and palates. The Interplastic South Inc. team included anesthesiologists, recovery and operating room nurses, and a pediatrician, in addition to plastic surgeons. It expected to perform about 45 surgeries in a week at a hospital in San Pablo. Schmidt was a medical degree from University of Wisconsin, did his internship, general surgery, and plastic surgery residency at the University of Florida. So thank him very much. Looking at our First Physicians Group, they had another milestone this past month. First Physicians Group qualified as a better performing practice in the medical group Management Associate, or MGMA. Performance and practice as a successful group medical groups. Based on the 2013 data, FPG was classified as a better performer in the following areas: profitability and cost management, accounts receivable and collections, and patient satisfaction. So congratulations to Eileen Gilbert and Dr. Rodman and their teams. And I had another slide in here I was going to show, and it didn't seem to make this presentation, but it's a picture that I guess I won't be sharing, but it's of our, Donna, do you have it or something? Is that?
It might be on the.
It's not, it's okay if it's not. Yeah. Yep. So we also had in quality and safety, and this just goes on to what Jan was talking about earlier about our Ebola preparations. I just wanted to thank Jan and Dr. Steve Taylor and Dr. Manny Gordillo for their leadership in this process. They have put in countless hours into making sure that our staff are safe, our patients are going to be well cared for if that time comes, and the community overall can have confidence in what we're doing. And I just wanted to thank you both. Steve, you're still here, aren't you? For everything you're doing. This is actually a picture I took this past Friday of one of the, what I guess I'm calling it the war room, of which Jan and Steve are leading. Where there's probably 24 people in this room, and they're talking about the various procedures and policies in place to deal with an Ebola patient if one were to come to Sarasota Memorial. And what you have is you have Janet Steves, who's one of our nurse directors, demonstrating and showing how some of the protective equipment works to everyone. And so, and that's Dr. Gordillo handing her the mask. So, Jan, just once again, thank you. And I appreciate, and everybody appreciates what you do. Steve, you as well. So thank you. That's my report.
Thank you very much. Is there anything on the consent agenda? No. Any public comments? No public comments. Legal matters, Mr. Zach Buffington.
Nothing to report.
Thank you. Any other business to come before this board? Seeing none, we are adjourned.